So based on the last video I posted on anatomy past question in School of Nursing, a lot of candidates asked me to explain more in detail about all the past questions in anatomy in School of Nursing. So in this video I have put together all past questions in anatomy in School of Nursing from year 1 to year 3. Okay, so but before we go into the video, my name is Nurse Dorian, registered nurse from Nigeria. If you are joining us for the first time, this is Unique Nursing YouTube channel. I would like you to click the subscribe button and turn the notification bell in order for you to get notified whenever we post a new video. Happy New Year to all my subscribers and my viewers. Welcome to 2024. I would like you guys to watch this video to the end, because at the end of the video I will tell you how to register for the upcoming online classes that we have for potential student nurses and for those student nurses that are already in school, that is for year 1 and PTA students. So make sure you watch this video to the end so that you can know how to register for the class. So let's get started.
So in this video I'll be talking about the past questions in anatomy and physiology in School of Nursing first year and of course the second year. So I'm starting with the regions of abdominal cavity. With a well-labeled diagram, describe the region of abdominal cavity. So what you have to do here is to draw the region. We have 9 regions of abdominal cavity: the right hypogastric, the right hypochondra, epigastric, left hypochondra. We have the right lumbar region, we have the umbilical region, the left lumbar region. We have the right iliac fossa, hypogastric, and left iliac fossa. So those are the 9 regions of abdominal cavity. The next common question is describe the flow of blood to the heart. The best way to describe this is to discuss the systemic circulation, the pulmonary circulation, and make sure you mention all the valves that are involved in the circulation, and of course the major blood vessels. Moving from there, the next common question is the conducting system of the heart. How the heart conducting pulses. Here you talk about the SA node, the AV node, and the Purkinje fiber. Another question that most students don't really pay much attention to is the cycle of Willis and saltatory conduction. Saltatory conduction is the rapid and jumping movement of action potentials along the myelinated axon. It's a rapid way of nerve transmission. So you read that up. It's one of those common questions in PTAs and of course the first year in School of Nursing. The cycle of Willis is the blood circulation to the brain. This is done by a ring of communicating arteries connecting the anterior and the posterior part of the brain in such a way that if there is any injury to the anterior part of the brain, the posterior part can still receive blood flow. In the respiratory system, we have questions like describe the pharynx. When describing the pharynx, you have to take into consideration the oropharynx, the nasal pharynx, and of course the laryngopharynx. So describe pharynx based on those 3 areas. Another common question in respiratory system is describe the lungs, that is the right and the left lungs. Remember that the right lungs has 3 lobes and the left lungs has 2 lobes because of the the space occupied by the heart. In the respiratory system, you may be asked to describe the cycle of respiration, which consists of 3 steps: the inspiration, expiration, and of course the pause. So make sure you explain the expiration, the inspiration, and pause. Other past questions that I would like you guys to know is this: write short note on the following: the physiology of balance, physiology of smell, the physiology of taste, physiology of maturation. Please take time and read all the physiology in the anatomy. Okay, know the basic so that if they ask you any of them, you're able to answer. Okay, so let's move over to the gastrointestinal tract, or the GIT. Some people call it the digestive system. It's still the same thing. So the major areas of concentration here are: one, the stomach. While describing the stomach, you have to mention the lesser and greater curvature, the fundus of the stomach, the sphincter, the body, and the pylorus. You know, we have 2 sphincter. One is the cardiac sphincter that separates the stomach from the esophagus, and the other one is the pyloric sphincter that separates the small intestine from the stomach. So another part of the GIT that you need to pay attention is the secretion of gastric juice. There are 3 phases: cephalic phase, gastric phase, and intestinal phase. So the cephalic phase is the vagus nerve stimulation by me perceiving the aroma or sighting the food. So another interesting area is the flow of bile, how bile is being flow from the common bile duct. Okay, so we take note of all those things and read them. Know how to describe the anterior view of the liver, or maybe with the posterior view as well, but they mostly ask about the anterior view of the liver and proper description of the liver. Do you know that the liver has 2 lobes, the right lobe and the left lobe? The right lobe is larger than the left lobe, and posteriorly you have the caudate and the quadrate. Okay, then in the urinary system, you have to know how to draw the kidney, the cross-sectional section of the kidney, and describe the ileum, the renal pelvis, and both the external and internal structure of the kidney. You might also like to know the nephron, the diagram of the nephron, and of course the function of the nephron. The most important thing you need to take note in the urinary system is the formation of urine, which is being done in 3 stages: the filtration, selective reabsorption, and secretion. Now in the musculoskeletal system, the most common question in that system is the description of the microscopic structure of a compact bone, which is also called the aphasean system or the osteon. So you have to describe that part of the bone, the microscopic structure of the compact bone, healing, stages of bone healing, the characteristics of synovial joint. You know, almost all synovial joint has almost all synovial joints have hyaline cartilage, capsular ligament. There are synovial membrane and synovial fluid, extracapsular ligament, muscles, and tendon. So those are the characteristics of synovial joint.
So all these past questions are based on my own nursing experience and from what I've gotten from those students that graduated from School of Nursing. So, and also based on the Ross and Wilson, which is the proof anatomy textbook for School of Nursing, especially here in Nigeria. All right, so that's the end of the video. If you want to join our online classes starting on the 10th of January 2024, make sure you WhatsApp us by using the number on the screen, and then you register for the class. We have classes for aspiring student nurses. We also have classes for PTA students and those who just got admission into School of Nursing, but they are preparing for their first 6-month examination. So you can also register for the class so that you stand a chance of succeeding in School of Nursing or getting admission into School of Nursing if you are yet to get admission. All right, so please subscribe to this channel and turn on the notification bell so you get notified whenever we post a new video. All right, share this video as well to friends that may love to see content like this. All right, so I wish you guys a successful 2024 once again. Thank you.